Hello everyone, I'm Alexis Manfred, Global Product Manager for Turmeric Market at Naturex Givaudan. While we are not able to meet together in person at VitaFoods today, I'm happy to get a chance to exchange with you virtually through this webinar. I hope you are all staying well. The topic of this webinar is first bioequivalent natural turmeric ingredient unlocks full turmeric market potential. When we look at the huge turmeric botanical market in 2020, we see that there are still major consumer concerns. The number one is around quality, natural, sustainable. There are still questions around adulteration, around the poor organic offer, and also about clean labeling. Does the product contains synthetic carriers or any nanoparticles? The second demand is around tangible effectiveness and understandable claims. There are too many ingredient brands on the market, very few comparative studies, some questions about the meaning of bioavailability, which curcuminoids metabolites are the most potent, and what is the right daily dose. But also more and more requests around safety. How can we guarantee safety of piperine? And what about safety of turmeric itself? And when looking on the new deliveries and way to improve compliance through smaller dose, we see that there is a huge potential of improvement due to the poor solubility and poor applicability of the market standard turmeric 95. And last but not least is around affordability. The average efficacy dose of turmeric 95 is more than 1500 milligrams per day, which makes this solution not very cost effective. For this reason, at Naturex Givaudan, we just launched a new natural solution to unlock the full turmeric market potential. This new innovation, an award-winning product, is called TurmiPure Gold, and it answers all at once the 5 major consumer market demands around quality and natural, tangible effectiveness and understandable claims, guaranteed safety, new deliveries and smaller dose, but also affordability. So what about quality, natural, and sustainability then? Well, TurmiPure Gold is a clean label and 100% natural formulation. It also supported with 2 patents, which makes this product very unique. And it benefits from a premium quality supply that guarantees integrity and no risk of adulteration, but also at the supply level, we have 2 grades, one with higher traceability to the field for the conventional grade, but also an alternative 100% organic certified grade. And last but not least, around responsible sourcing and sustainability supported by the Pathfinder program, but also as a concrete example, this product saves 93% of turmeric roots to reach the same efficacy level than the market standards. Moving to the second demand around tangible effectiveness and understandable claims. Well, TurmiPure Gold benefits of the strongest comparative clinical study of the market. This study was performed in France with the Bio40 CRO. The design is pretty robust. It's a randomized crossover with 5 products with the same HPMC delivery in capsules, with a clear statistical plan with primary and secondary endpoints well defined, and it was registered on clinicaltrial.gov, and now the manuscript is in preparation for submission. In this study, 5 products were tested at the recommended dose by the supplier. One is the market standard turmeric 95 at the dose of 1500 milligrams. Then also was assessed the TEP, which is the turmeric 95, when mixed with piperine at a dose of 15 milligram. Also, it was compared to the FIT, which is a phospholipidic formulation of 20% curcuminoids at a dose of 1,000 milligram, and NOV, which is a liquid micellar formulation of 6% curcuminoids at a dose of 1,000 milligrams. And last but not least, TurmiPure Gold at a standardization of 30% curcuminoids at a low dose of 300 milligram. And what makes this study very different and very exciting is when we look at the difference. Our product was assessed as a very low dose. When we compare to previous clinical pharmacokinetic turmeric papers in which the enhanced formulation were assessed as a much higher dose of around 1,500 milligrams. Then in terms of number of subjects, we have much more subjects, 30 subjects in this crossover design, when the average on the previous studies were around 10. Also in terms of metabolites quantified in the study, for the first time we reach 100% of what is scientifically known, when the previous study were focusing on 12%, and I will explain more about that on the next slide. But then also about the duration. We are meeting the 1 day, 24 hours gold standard duration, when previous study were at the average of 12 hours. So when we say this study is based on the most exhaustive quantification of curcuminoids metabolites, please let me explain. Here on this slide, you can see a picture of the most commonly known curcuminoids and metabolites. On the left, you have the parent curcuminoids, curcumin, DMC, BDMC, and then you can see phase 1, phase 2 metabolites. In this study, we were able to quantify one by one 15 metabolites here in bold, and those 15 metabolites, curcumin, DMC, BDMC, THC, HHC, and their relative sulfate and glucuroid form count now for 100% of what is known to be absorbed in the human blood. And by quantifying this 100%, we discovered that free curcumin or unconjugated curcumin only represent 1% of what is found in the blood. And curcumin, free curcumin, was one of the main markers of half of existing pharmacokinetic study. And the other half of previous existing studies were quantifying those 9 metabolites in yellow. You can see curcumin, DMC, BDMC, and relative sulfate glucuronide form, but those 9 metabolites only represent 20% of what was found in human blood. So also it confirms the interest of curcumin, but not only free curcumin, but curcumin and all its relative metabolites, because this was found to be 95% of the metabolites found in the human blood. So in terms of results behind this study, we can see that it supports the idea of minimum dose for maximum effectiveness. Indeed, TurmiPure Gold was shown to be the most bioavailable turmeric at a low dose. A 30 milligram dose of TurmiPure Gold enhances 24 times more the absorption of total curcuminoids than the turmeric 95 at 1,500 milligrams, 22 times more the absorption on total curcuminoids than the market standard added to piperine at 15 milligram, and 6 times more than the phytosome formulation at 1,000 milligram, with very statistical significant p-value. And also it enables to say that TurmiPure Gold is the first bioequivalent turmeric at a low dose, because TurmiPure Gold at a very low dose of 100 milligrams delivers in your blood as many curcuminoids as high dose of market standards. Roughly 2 grams of turmeric 95, more than 2.2 grams of turmeric 95 added to piperine, more than 700 milligrams of the NOV formulation, and almost 3,000 milligrams of the FIT phospholipidic formulation. But also, this new age science helps to answer three major scientific pitfalls. And that's very important in terms of understandable and tangible claims. One is that bioavailability X factor is dose dependent. So when we compared previous studies on the same ingredients with our study at a much different dose and comparing with the same metabolite quantification, we observed that the higher dose of enhanced formulation you test, the higher bioavailability X factor you obtain. So it means that, in other words, it's impossible to estimate the efficacy dose of a bioavailable turmeric based on its bioavailability improvement factor. And also it confirms that the right dose for claims and tangible effectiveness is the clinically tested dose. The second important pitfall is around black pepper efficacy in improving turmeric bioavailability. And basically what we show in our study is that there is no statistical significance of piperine to improve absorption of total curcuminoids nor free curcumin at its recommended dose of 1%. But also it raised the question about the real benefit of adding piperine in turmeric products. And last is around free curcumin that is known as a very potent bioactive of turmeric. Well, free curcumin only represented 1% of all quantified metabolites in human blood. So it should not be the only blood marker of turmeric formula absorption or bioefficacy, but all native curcuminoids and their metabolites should be quantified to assess better bioavailability improvement and turmeric bioefficacy. What about safety then? Well, looking at safety, on TurmiPure Gold, we run a dedicated safety program. We've published toxicity report that shown no genotoxicity, but also a very high no observed adverse effect level established at 3,000 milligrams per kg body weight. But also we just finalized and got the results of a new clinical safety study that assessed the safety and tolerance of TurmiPure Gold at a dose of 1,000 milligrams in healthy subjects. This study was done in France with a Biofortis CRO. The design is pretty robust. 60 subjects were involved. It was registered on clinicaltrial.gov. It's in preparation for submission. And as you can see, there were a well-balanced between men and women, and also a wide age range between 19 and 59 years old. And when we look at the endpoints, well, the primary endpoint on gastrointestinal tolerance after 5 weeks supplementation has shown no significance between groups. But also when we look at the exhaustive list of secondary endpoints, and for the first time, a study assesses more than 60 parameters on a turmeric ingredient, shows that either on individual gastrointestinal, vital sign, hematological safety, clinical chemistry, blood safety, renal function, hepatic function, urinary safety, and bias factors, but also adverse events, that most of those parameters show no statistical significance between the group. And the conclusion from the investigator was the present trial confirmed the safety of the TurmiPure Gold product for a chronic consumption of 5 weeks at a high dose of 1 gram, which is more than 3 times higher than the recommended efficacy dose of 300 milligrams. So then moving to new deliveries and smaller dose. Well, TurmiPure Gold benefits from superior versatility in application. It has the smallest efficacy proven daily dose. It's water dispersible. It has a bright yellow color, a neutral taste, a great color and curcuminoid stability, and also a very ease of processing and cleaning, but also a gluten-free ability. And that enables TurmiPure Gold to enter in endless food supplement applications, shot, gummies, tablets, capsules, but also instant drinks, dry mix, and many more. So as a conclusion, we can say that TurmiPure Gold, our disruptive solutions, answers all turmeric market needs at once. Around quality and natural, it's 100% natural, it's 100% organic certified, and benefits very, very strong supply. Also, in terms of tangible effectiveness and understandable claims, it's the first bioequivalent turmeric at a low dose. 300 milligrams of this product delivers the same amounts of curcuminoids in blood than high dose of market standard. It guarantees safety with a very strong proprietary toxicology and clinical safety studies. It enhances new deliveries thanks to its low dose, but also high applicability. And last but not least, it's among the most cost-effective turmeric solution of the market. So I would like to thank you for your attention. And hopefully, as planned, we can meet in Geneva next September on our booth and during our conference. Thank you so much.